Latest national data is suggesting that children account for 15% of all COVID cases. But are children dying of COVID? We've been investigating that today, and we found that answering that question depends on who you ask. Our health reporter, Haley Hernandez, is live in the Med Center tonight. Haley, local doctors are saying one thing, the health departments are saying another thing. So what are we supposed to take from this?
So this is actually kind of a complicated answer. I'm going to try and simplify it for you by just reading you the statement that the medical examiner sent to me. It says, from the time period December 2019 to present, so pretty much the entire pandemic, there were 0 cases of babies 12 months or younger coming to our office with a COVID cause of death. There were 5 cases that were inquest only. Now that means that there were 5 cases where COVID-19 was listed on the death certificate, but no autopsy was done. Kids are now being infected seemingly as easily as everyone else in the population, according to Dr. Michael Chang, pediatric infectious disease specialist with UT Health. That is different than what was thought at the beginning of the pandemic. And even though the county and city health department say there have been 0 deaths in kids under 12, there are 5 inquests, basically meaning death certificates where COVID was listed as the cause of death, but no examination was done. This is a heartbreaking statistic, but one that's important as it shows COVID is impacting young kids, as doctors have so urgently tried to warn, but it's still a very small number.
I can't comment on any specific cases, but across the country and in our region and state, there are infants who have died from COVID-19.
Epidemiologist Caitlin Jetelina says kids under 1 have always been considered at risk for COVID complications.
Just like obesity is, just like asthma is. And so what that message is to parents is that if you have a kid under 1, they need to be extra vigilant for COVID and for who's holding the baby and who's really around that baby until we can get a better understanding.
Now, she says that means all parents, caregivers, any family that's going to be around should be vaccinated, but definitely be wearing masks, especially even vaccinated or not, since we have the information now knowing that vaccinated people can still transmit the virus to unvaccinated people like kids. Reporting live in the medical center, I'm Haley Hernandez, KPRC 2 News.